welcome to Your Pet, Your Vet. I'm Dr. Burr, and today we're going to talk about dental care. It's so important in veterinary care and pets. As I probably mentioned in previous shows, probably the two most significant health problems in older pets, or even middle-aged pets for that matter, is dental care and obesity. And we're going to talk about dental care today, and the next show we'll talk about obesity. I want to introduce you to Phil. Phil's my vet assistant who works with us here at Chatuge Animal Hospital. Veterinary technician, moved here from California boy. So he's showing us how to be cool and groovy. Is that good?
Sure.
So and Dakota is the star. This is a 6-year-old Shih Tzu. She is here. He's a male neuter Shih Tzu, 6 years old. You can see how cute he is. But I want you to take a look at his mouth. His dental disease is not severe, but it's where this is the time that we need to start addressing it. If you'll take a look here, he's a really good boy. Hello. Okay, we're gonna zoom in, I hope, and I'm gonna show you. See how he actually has a fractured canine tooth right there. Fortunately, the pulp is not exposed, so it's not painful. You could get caps put on these teeth, but most people don't go to that expense. But we do worry about, if you look real close, you'll see a little brown stuff on the tooth, and the further back you go, you'll see it a little bit more, maybe. And then I'm going to slide this way to show you this side, because this side shows it even better. And you can see here, this tooth, I wonder if he isn't in what you call a cage chewer, because he's done something to wear his canine tooth down. But let's see, can you see that tooth right there? That's called the carnasial tooth. Let's get it in the light a little bit, Phil. Can you see that brown stuff? That's called tartar or plaque, and that causes all the disease, if you can see that. To give you an example of a really severe mouth, I have a picture, so I'll have you move over here just a minute. This is the progression. This is early gingivitis here. It's almost normal, but you can see this kind of yellowish stuff. That's called tartar and plaque. And look how it progresses and gets worse as you go from my left to the right. And you see how the gums get more inflamed, start to recede. And this is severe. You've got root exposure. So this is what causes all the disease in pets. And if you don't tend to this appropriately, they can end up having oral surgery, i.e. tooth extractions, and we have to close those, surgically close that defect. And we also get into what we call antibiotic fillings to try to save teeth where you have some periodontal disease. And it's a very important part of pet care, because although pets don't complain about pain, in dental pain, that is, they don't raise their paw and say, my mouth hurts. However, from the human experience, we know that gingivitis and periodontal disease especially is very painful. So veterinarians like myself, we all assume that it's painful in pets. The anatomy, the physiology is all the same, so it must. So we feel like this is not only a health issue, but almost a humane issue. You want your pet to be comfortable, because if you don't take care of this, you're dealing with chronic pain. The other issue is that you can get into major organ infection from infected mouse. The bacteria will enter the bloodstream and can affect the heart, liver, kidneys, and lungs. So this is a major health problem. The good news is it's very easy to address and easy to prevent. What Dakota needs, and it would be pretty routine, she may have some periodontal disease we'd have to treat. We don't really know until we get into the mouth. It's a tooth by tooth assessment. It's like saying we have 32 patients we got to look at when we're working in their mouths. So then we'll go in, and we talked about this on a previous show, I think, but we'll do the ultrasonic cleaning, and we do fluoride treat and polish. And like I said, if you catch these early, that's probably all you have to do. But if you wait and not address it, then it gets to be a much more involved procedure, and therefore much more expensive. I'd like to take a little break right here. I want to bring you another patient that I want to show you their mouth as well. All right, well, let me introduce you to Pinky, the Chihuahua, 8-year-old spayed female. Pinky is also boarding with us, is that right, Phil? Sure. But we did a dental cleaning this week. Well, let me show you Pinky's pretty mouth. Let's take a looky here. Let's see. Let me show everybody. It's okay. Look at these gorgeous teeth. I'm gonna take my time. Can y'all see that? Isn't that gorgeous? Her teeth were just done. Now I think do we have to extract any of hers?
No, just her liver mate.
Okay. Oh, the litter mate had some, but look how beautiful her teeth look. Is this gorgeous or what? Isn't that gorgeous? And so And now she's 8 years old, and keep in mind, if her mouth stays that healthy, when you go home or when you get a chance, take a look at your dog's mouth. If they really got a lot of tartar and plaque like that, you'll notice the gums will be inflamed. That's not good. Be sure to see your veterinarian and have that taken care of. Again, we offer, for example, a 20% discount. That's always helpful. Here at Lake Chatuge Animal Hospital and Tri-County Animal Clinic, we try to make it as affordable as possible because we realize there's an expense involved. But this is important. Studies have shown that pets who have healthy mouths, on average, live 2 years longer than pets that do not. So it's not only an issue of quality of life, but how long your pet lives. Well, that's it for this show of Your Pet, Your Vet. Well, we'll see you next week, and we'll bring up another important pet health topic.